Welcome to Community Leadership, a conversation about the community in which we live with the leaders who are shaping our community. Today we have the opportunity to talk to two leaders of organizations that provide vital services to our community, healthcare and higher education. I am pleased to be joined by Dr. DeRionne Pollard. She is the president of Montgomery College, and Kevin Sexton, the president and CEO of Holy Cross Health. Dr. Pollard and Mr. Sexton are here to talk about a truly unique partnership that Holy Cross and Montgomery College undertook 5 years ago. This partnership has developed a foundation for a very exciting future for all of us who live, study, and work in the greater Washington, D.C. area. Thanks so much to both of you for joining me.
Delighted to be here.
I want to start the conversation broad and ask you to talk about your areas of expertise. And tell me a little bit about what is happening in our Montgomery County community that is affecting higher education and affecting healthcare.
Sure. Well, let me start. If I had to pick one thing in our county that's affecting healthcare and will affect healthcare probably for the next 20 or 30 years, it's the aging of the population. In our whole history, we've produced 125,000 people who are over 65 today in Montgomery County, but in 20 years, we'll double that number. So we'll go from 125 to 250,000 people. And obviously, two things happen that relate to healthcare. One is seniors use significantly more healthcare services as they age. And that includes hospital services and other services. But just in hospitals, 6 times as much as people under 65. The second thing is that many of those people who will become seniors today deliver healthcare. And as our workforce ages into retirement, they'll go from delivering services to needing services. So what we're thinking about is the pipeline. How do we make sure that to provide access for our community, that we have the trained staff that we need to be able to do that? And so I was smiling when you mentioned it because I think this is an overlap between the educational challenges and the healthcare challenges. There are certainly others that are important, but I would put that one as number one on the list.
And I'm going to imagine you've seen a number of those challenges affecting Montgomery College.
Well, clearly, obviously, an aging workforce is something that we both share, I think, as Kevin mentioned. But I think the part that's even more provocative about this is that while we have the aging workforce and clearly the needs that are going to be responded to for an aging population, one of the unique challenges that we also have a middle skills shortage in not only in Montgomery County, but clearly in this country as a whole. So we know both our President of the United States and the Governor of the state of Maryland have charged higher education to produce not just 10%, not just 15%, but to increase almost by half the number of graduates that we produce by 2025. So if you really think about this in very realistic terms, we're not just talking about degrees that lead to baccalaureate degrees and medical degrees and law degrees. We're also talking about those folks who provide, I think, the most significant work in our society in the middle skills area, those who have short-term certificates that lead to a profession, but also those that have 2-year degrees. And one of the most clear areas of this is in nursing. One of the things we know for sure is that while we've had a ebb somewhat based on the recession that has occurred, right now we're seeing very clearly that there's a need for nurses and all of those folks who support the healthcare operations, not just nurses, but coders and all the types of things that go with that.
And I can imagine there's an interplay. So not only are we seeing a great need in our community, we're also seeing that our faculty who are teaching those students are aging out. Yes. You've got your healthcare workers aging out. So it's kind of all hitting at the same time.
Exactly. Having enough faculty to teach students in these areas is clearly one of the challenges. No question about that. I think as we look ahead, DeRionne's right. We've seen a little bit of a reduction in short-term demand, but I always say to people, you got to distinguish between weather and climate.
Yes.
And when you run the numbers, what we're going to need are more people. And so I think the forbearance and the stick-to-itiveness in terms of where the college is headed is right on the money, and it's going to make a huge difference for the county.
And that gets to what is it mean for the residents of our county? Because I know they hear, okay, I know that the population's aging. I know that many more of us are going to need health care, but what does it mean for me? What does it mean for me now? I think that's a question many have.
Right. I think it's going to mean that there will be a need for more services, some traditional healthcare services. We're going to talk about that, I'm sure, the new hospital. But it also means we're going to have to find ways to deliver services more innovatively. And it is another case where there's an overlap with education. We're going to need more people able to operate independently, because I think they will be delivering services outside of institutions, sometimes in people's homes. Sometimes those are the most cost-effective services, because this isn't just a county issue, it's a national issue. This aging has to be accommodated, and accommodated well in healthcare without having the cost become so prohibitive that we really run into significant financial problems that affect everybody, young, old, healthcare or non-healthcare workers.
I think the other thing related to that is the whole economic impact issue that I think we'll talk about the hospital a little bit later. But when we think about the fact that we need workers to work in these facilities, when we also think about the fact that we're trying to craft a more sustainable economic engine, a driver for the county, that becomes very significant. So for me, I look at this both in terms of actually having spaces for our students who live up county to be able to have their clinical rotations, which is going to be significant with the new hospital, but also in terms of the park itself and the idea that we're trying to really anchor ourselves and define ourselves as these anchor institutions. I read a great piece not too long ago that talked about eds and meds and these ideas that in thriving economic realities, the two connecting forces are education and healthcare, because they are intricately and intimately connected to the well-being of the community, and therefore one thrives only if the other thrives. And you can see that being very much affected in terms of looking at the population, but also in terms of trying to craft spaces and places for the community to come together and really have substantive conversations about the things that are happening in their community.
Wanting to jump in.
Well, it's so true. I mean, I think the two important aspects of that are that the services are needed in the community, and the jobs stay in the community.
Yes.
These are not easily exportable jobs, because they are human services that people need, and they mostly have to be proximate to them to be delivered. There will be some variations on that over time. We certainly use technology more than we used to, and we'll use it more in the future. But in terms of advising people, if they have an interest in serving people, this is a great field to go into, because of, in addition to everything else, the stability that comes from knowing you're going to have twice as many seniors and needing healthcare services makes it a pretty good bet.
Yeah.
Well, I want to take a break right now, take a break here, and then when we come back, we're going to talk a little bit more about exactly how our two institutions came together, and then get into the specifics of the new hospital coming to Germantown. We'll be right back for Community Leadership. Thanks so much. Welcome back to Community Leadership. I'm joined by Mr. Kevin Sexton and Dr. DeRionne Pollard. I want to start with you, Mr. Sexton, with a question about what brought you to Germantown. When did you decide, and how did you decide that that was a perfect location for a new hospital?
Well, back in late 2006, 2007, we made a long-term assessment of our hospital and its capacity and of the county. And I was talking earlier about aging, and it's the thing that jumps off the page at you when you make that assessment. And we saw the tremendous increase that was going to come, a population in the county that was going to grow, was going to be seniors, and primarily seniors. And it was going to grow throughout the county, but in a way that surprised us, more in the up county than in the down county, which I think is not conventional wisdom. And I think that's because the up county is younger to begin with, but it actually starts to get older faster. So we took note of that. We also took note of our own situation. We could not expand significantly on our site. And so we talked about creating capacity still in Silver Spring, addition through subtraction, which was to give the 25 to 30% of our patients who come from the up-county a place that was closer to home. So we began to think in that direction, but we did an actual zip code by zip code analysis to try to identify places of need, places of of population concentration, and populations that were not close at the time to any other hospital. And what we saw was that the Germantown, Gaithersburg area was the largest concentration of people in the state of Maryland without a hospital.
Wow.
Montgomery County hadn't had a new hospital approved in 35 years. And yet the county had added over 300,000 people during that time. And so we identified the general area, and then we began to look at where within that area we could find sufficient amount of space, close to both public transportation and good highway structure. And when we took out the map and looked at the properties that were available, there was this property available right on the campus of Montgomery College in the Science and Technology Park. And it immediately occurred to us and to me that this was more than just a great physical location. This was an opportunity. You know, this was a chance to actually do more than just do bricks and mortar, because what we've said was, yes, we need more physical space for a new hospital because we are going to have this population growth, but we also know we're going to need healthcare workers. What better place to do that? We didn't know.
Sorry, I was going to say your eyes almost light up and
Well,
sparkle when you say that.
Well, I still remember that. I mean, and the truth is, what we didn't know at the time was no one had ever done it before. And of course, that makes it even more intriguing.
Yes,
you know, a hospital on a community college campus. And so I approached the college about whether they would be interested in a hospital as a tenant in the park. And we immediately got to the notion of, it sounded like a great idea, but it especially would be a great idea if we could do it with an educational partnership. We actually started and even began the educational partnership while we were still waiting for approval on the hospital. So we made a commitment we were going to do that together, and we've been at that. In fact, we will be 5 years with the partnership completed this December. So it's been a very interesting road, and the college has been able to grow their nursing school. We've been able to provide both some financial support, some logistical support, some teaching support, and we've worked together as a joint task force and found ways to work together that I don't think any of us the first day would have contemplated, and that's made it especially exciting.
So true.
I was going to say, it was already in place when you arrived as president of Montgomery College, and I'm sure that was just amazing opportunity to walk in the door and already see this synergy, this partnership that has already evolved.
Well, and it was very exciting. I think the idea, as Kevin mentioned, any time when you get to be the first at doing something, that's always very interesting. So the first community college in the country to have a science and technology park, the first community college in the country to have a hospital on the grounds of its campus, I thought was revolutionary. And I thought, what forward thinking. So I always applaud the people, Kevin and others before I arrived. They get to benefit from the fruits of that. But the reality about it also, it anchored me in this idea of what I really believe a college can be for a community, both in terms of providing an educational pathway from K-12. But the beautiful part about this partnership is something that was alluded to earlier, the opportunity to train and educate people in their own community and allow them to contribute to the economic vitality of that community. That to me is very significant. So this partnership really has a multifaceted, very deep relationship, both in terms of obviously the benefits of the college being able to identify a new revenue stream for the institution, but more importantly, to create a pathway for our graduates into viable work options, looking at the whole breadth of the healthcare industry, but then more importantly as well, that we get to be this economic driver. We were approached by the county and the state to really create this science and technology park, but you can have a lovely idea if you don't have a tenant. And the beautiful part about this is that we have a tenant that not only buys into the vision of what this park can be for the community, but very deeply understands how the college can be a partner with the hospital in really creating, I think, something truly special. So for me, it was a delight to walk into it, and certainly look forward to when the park, when the hospital opens next year.
I do have to say, though, DeRionne did come and we had a lot of work done, but we were by no means done, and I give her a great deal of credit for seeing the potential and stepping up very quickly, because she had to make some decisions early on and taking a hold from the college's standpoint, and I think we've had a great partnership.
I agree. One of the good things about partnership is that you have to love the partner you're in bed with, and this is the one that I love. I love Kevin and Holy Cross Hospital, because what it's doing for the community, what it's allowing the college to do for the community is significant.
Well, I want to take a break right now and get more into the details when we get back. You're watching Community Leadership. Welcome back to Community Leadership. Again, I'm joined by Mr. Kevin Sexton and Dr. DeRionne Pollard. Mr. Sexton, tell us a little bit about what is the hospital going to be like? It sounds exciting, but I'm sure many people want to know, what is it going to offer to the community and what's it going to look like?
Sure. Well, I'm pleased to say the hospital is well under construction, and it is being skinned right now, if you will. The walls are being put up. It's already as high as it's going to get, and it will be closed in this summer and ready for operation next fall. So we have a pretty good idea what it's going to look like, and we have a pretty good idea what it's going to do. It's a community hospital in a traditional sense. It will provide a range of medical and surgical services for the population, particularly in this part of the county. As I mentioned, there are a lot of people who live here, and they travel a good long way for health care now, and this will mean some services, many services will be closer to home. Obstetrical care, medical care, surgical care. We will do certain really high-risk things, like level 3 neonatal intensive care unit will still be down in Silver Spring, but we will do significant amount of obstetrics and mid-level neonatal care up here. We will have one very important service that we don't have in Silver Spring at all, and that's psychiatric services. There is a real need in this county. It was one of the aspects of the program that was endorsed by all of the state and mental health professionals. Finding places for people who have some emergency needs for inpatient psychiatric care is very tough to come by. Those beds have shrunk dramatically over the years, and so this is an opportunity for people to get care close to home and not have to go far afield. And it's a very important thing for hospitals generally in their emergency rooms, having a place for people who need that service to be able to get it and not have to wait unduly for it. We're also going to have a medical office building on the campus, which will allow physicians to be close by. And we have room, which is a luxury for us, being in Silver Spring where we have so little room, to be able to expand as time goes on. But our goal is to be a true community service. We feel like we do that very well right now in Silver Spring, both in terms of use of our facility by the community and a community focus. The hospital also, when we announced our intention to build this hospital, said we were going to also triple the size of our community health centers. We had one in Silver Spring at the time, and since then we've already built the other two. One of them is in Tacoma Park and the other one is in Gaithersburg. That gives us a place right now for people who have no insurance to go for their health care. And now we'll have a hospital obviously close certainly to the one in Gaithersburg. So our goal is to put a comprehensive range of services in place for people as they need them, and to get smarter about how we deliver care in the future so that we can do this in an affordable way.
And how does that connection work in synergy with Montgomery College?
Well, the most significant synergy is is the workforce. We know that over time, as we've been talking, we are going to need at all hospitals, not just ours in the county, more workers and replacement workers for the people who are retiring. So the college, really community colleges generally, and this college specifically, are an enormous source of healthcare workers, and I do think it is the future of that. It is just awfully expensive for somebody to go out and get a 4-year bachelor's degree and a nursing degree, or a therapy, to work in a therapy. So being able to go to a community college, be able to work, and then we provide scholarships at the hospital for people who want to go back and get additional education while they're still working. So the most important synergy is just that we will be able to have a supply of very skilled workers. The synergy going the other way is that obviously we can provide some of the faculty. Our experienced nurses would love the opportunity to get a little time off and still keep their hand in and still keep their income and their health insurance, et cetera. So we've already started that. So I think that's another one. But I'll give you just one other sort of very specific example. Maryland codes for healthcare services different than any place else in the country. The coding system to determine how they record people and then how they pay for people is different in Maryland. We, every place else, had taught the courses that were national. We didn't have any courses that were actually specific to the Maryland codes. And we got together with Montgomery College, and in no time we had a program for that. I mean, it sounds pretty mundane, but let me tell you, if you don't have coders, you don't get paid.
That's a world of difference.
And so it made a world of difference, and it happened, so fast because we had this group in place to identify the problem and get right on it.
What energy do you think having a hospital on a community college campus will bring?
Well, I think as our anchor tenant most clearly is the idea of us being able to, obviously, as a pipeline we talked about. But I think the other thing is that as we're looking at attracting other tenants to the park, there is a natural synergy that occurs and particularly with our county being so dedicated to life sciences, how do we begin to attract other companies into the park that may see a potential to craft a pipeline from Montgomery College to the hospital to this company and really create some synergies in ways that we may not have seen thus far. I would also say, and I love Kevin's point earlier, the idea that oftentimes we think of hospitals, we think about the fact that they're doctors and nurses and people in therapies, but there's a whole infrastructure. A hospital is a business, so they need accountants, they need business managers, they need other types of things that allow us to really have a focus in terms of our curriculum. And the last thing is that we have the opportunity to really partner, I think, to impact the community in very powerful ways. These are two dominant, very well-respected brands, and to bring those brands together, I can only imagine the impact it's going to have in the community, both in terms of Up County, and as a resident of the Up County, I'm very happy that we'll have a hospital there, but also as a brand in terms of the whole county itself.
When you look forward a year from now, approximately when the hospital opens, what do you think is going to be different at Montgomery College, at the Germantown campus?
Well, one is I think we will, I would like to think we'd have more tenants as well coming to the park. They'll see the energy there, that we are a good, responsible folks in terms of working with each other. I'd also like to think that we have identified some additional slots for our students who are going to be studying in the health sciences to go to. I think that we'd have a very comprehensive community education program that we've worked together on in ways that can be very real. And last but not least, I'd like to think that we could also be taking this idea and concept out nationally. I do think that there are other community colleges that could benefit from looking at this relationship, other partnerships with hospitals that can be very significant. Those are things that immediately come to mind when I think about where we might be in a year, besides celebrating the opening of a new hospital, right?
We're definitely going to have a party.
Yeah.
I was going to say, when you look forward to that day, that opening day, when you cut the ribbon, what is that going to mean to you?
Well, I think it's a chance that people don't get very often to actually start something from scratch. And so there's an opportunity for a hospital to be, and not just an anchor in the park, but an anchor in the community. I mean, a place of the size of Germantown, the number of people, there is, though, a sense of place that comes with a community hospital, I think. And we are committed to making it more than just a place, but to make it a living, breathing organism. We're looking for people to work there who really want to connect to those communities, and I think we're good at that, and I think we're going to do a very good job of it. But until you actually get get it going, I don't even think you can you imagine some of the possibilities, some of the ferment that comes from the college being there, the traffic, the interchange of people and ideas. We've seen it in our committee, and I think we'll see it much more so as we begin to move down the road. So I think it's going to be an exciting time. I think the chance to do something important and to do it with people who are creative and who you like to work with, that doesn't come along that often. So we're thrilled.
Say, any final thoughts?
You know, the only thing I would offer, and I love Kevin's point earlier about Germantown. It's interesting to me, I heard one of our council members say that if the area of Germantown were actually incorporated, it would be the second largest, I believe, city in Maryland. So when you think about the fact that here in this partnership, we get to serve tens of thousands of people in a very real way, meet a need that was not there, and do it in a way that can make a long-lasting impact. I'd like to think that's something pretty special, and I'm honored that we get to do it with Holy Cross Hospital, and I'm glad that we get to have, I think, an everlasting impact in this community, more so than we even have at just the college itself.
I want to offer you the same. Any final thoughts?
Well, I don't think I could have said it better than Dr. Pollard. It's a once-in-a-lifetime opportunity. We see it that way, and I think the fact that as she said, we have national. There's a potential national model here. That's going to be something that will outlast us.
Yes.
At least I sure hope so.
Great. Thank you so much for joining us today, and thank you, Dr. Pollard. Thank you, Mr. Sexton, and thank you for joining us for Community Leadership. I'm Elizabeth Homan.